going to demonstrate the shoulder routine procedures, namely AP, wherein AP is AP projection contains the external and internal and lateral rotation. So and the brushes method, we're going to demonstrate that later. First is we need to demonstrate the AP projection of the shoulder. So the cassette that we're going to use is 24 by 30 centimeter or 10 by 12 inches. Then position the port center at the shoulder joint to the midline of the grid. Center to the midline of the grid. Midline of the grid. The next position is adjust the position of the IR so that the center is 1 inch or 2.5 centimeter inferior to the coracoid process. So this is your coracoid process. Next one, if necessary to overcome the curve of the back and the resultant obliquity of the shoulder structures, slightly rotate the patient enough to place the body of the scapula parallel to the plane of the IR. So you can see the patient is on. And so there were three rotations, no? 3 hand position and its effect on the proximal humerus. Again, there are 3 hand position and its effect on the proximal humerus. First is, if the hand is supinating, if you're going to instruct the patient to supinate his hand, will position the humerus in external position. That's one. If the hand of your patient in a supinated position, then the humerus is in the external rotation. And if the palm of the patient if the palm of the hand of the patient lays against the hip, will position the humerus in neutral position. That position. The next is, if the posterior aspect of the hand lays against the hip, will position the humerus in internal rotation. Very good. I guess that. Then, again, for external rotation, humerus, ask the patient to supinate the hand unless contraindicated. So remember that if the patient has an injury, do not instruct your patient to rotate his or her hand because there is an injury. Then abduct the arm slightly and rotate it so that the epicondyles are parallel to the plane of the arm. This is the external rotation of the humerus. So if the neutral rotation of the humerus, ask the patient to rest the palm of the hand against the thigh. This is the neutral position of the humerus. So if you want to rotate his humerus in internal rotation, ask the patient to flex the elbow, somewhat rotate the arm internally, and rest the back of the hand on the hip. Very good. The next method that we will going to, the central ray must be angled at the mid-shoulder joint. Mid-shoulder joint. That one. Mid-shoulder joint. And the SID that we will going to use is 40 to 44 inches or 102 to 113 centimeter. Then always remember that in collimation, collimate on the side of the shoulder, and make sure that you leave a 1 inches in the collimation. 1 inch, include the shoulder joints. Next one is the Grashey method. in Grashey's method, the cassette that we're going to use is 18 by 24 centimeter or 8 by 10 inches. So, in positioning, the patient must be in erect or supine position. So, today, the patient is in the erect position, Then, instruct the patient in oblique 35 to 45 degrees toward the side of interest. Then, make sure that the body of the scapula should be parallel with the IR. Hand and arm in neutral rotation. So, position the patient 35 to 45 degrees. Center his shoulder at the IR. That one. Today we're going to demonstrate a 35 degrees angle for the Grashey's method. Then, center the scapulohumeral joint and IR to the central ray. And make sure that you have a 2 inches or 5 centimeter inferior and medial from the superolateral border of the shoulder. Then, make sure that the central ray must be centered at the mid-scapulohumeral joint. Scapulohumeral joint. Centers. Make sure the center obliques. Next one is the SID that we will going to use is 40 to 44 inches or 102 to 113 centimeter. Then the collimation, so the upper and lateral borders of the field are to the soft tissue margin. So always leave 1 and 1/2 inches at the in collimation. Let me check. Do not move, sir. Center the IR, the central ray. And center the central ray. Perfect. That would be all.